Thanks so much. Thanks so much for joining us today. This is our July virtual office hours session, and the goal is to give you a little bit of background information on the Congressional District Health Dashboard, and then do a brief site walkthrough and see if you have any questions. Feel free to drop questions in the chat as we go along. You can also come off mute if you're more comfortable doing that. I'm gonna try to share my screen now. Okay, great. So just jumping right in, I hope. So, the Congressional District Health Dashboard launched at the beginning of 2023, and until prior to our launch, there really wasn't rigorous nonpartisan data on health and conditions that affect health at the congressional district level. We've had data at the state level and at the county level, but prior to the dashboard, this type of information wasn't available for free to anyone that wants to use it. So we were proud to launch the dashboard in partnership with Robert Wood Johnson Foundation. Our goal is to provide granular data at the district level and to help inform and catalyze priority setting. We believe that data can help reveal challenges, inform policy, and hold policymakers accountable. Our audiences, as I've already kind of mentioned, are really anyone. But in particular, we're interested in making sure that elected officials and their staff, advocates, folks working in the policymaking space know about our tool, know how to use it, and that journalists, researchers, media, and the general public are also aware of it to further spread the word. Our experience with the Congressional District Health Dashboard is built on our experience developing and leading the City Health Dashboard, which similarly provides data at this geography level, the cities, where previously that data was not available. So I've been talking about data, I've been talking about the dashboard, but to get into what the dashboard measures, we have 40 metrics for health and drivers of health. The measures span health outcomes, social and economic factors, health behaviors, physical environment, and clinical care. For most issues that you might be interested in health, public health, or social determinants of health, as we sometimes say, drivers of health, you are likely to be able to find a metric that's related to those on the dashboard. And all of these are available at the congressional district level and at the state level. There are some that are also available at the census tract level. You can see on here that includes some of these whenever there's a triangle. And then if there's an asterisk, we also have that data available for demographic groups. So that would include by age, sex, or race and ethnicity, depending on the data available. So our team is actually based at the NYU Grossman School of Medicine, and the experts on our team in geospatial technique, they're epidemiologists. They have a very rigorous approach to how we select and add metrics to the dashboard. We use national data sets to ensure that we will have data available for the whole country. We only select measures that have rigorous methods underlying their original data collection. So we look at, how the data source is actually created, in addition to then applying our own methods to ensure that it's accurate to the congressional district level. All of our measures reflect public health priorities. We update them regularly, annually, and as soon as sources become available, like Medicaid enrollment, we update more frequently. And the domains that I mentioned on the last slide, we try to have a balance of metrics across the 5 overarching domains. This is our homepage, just what it looks like. And just to mention again, our sponsors on the right, NYU Langone Health and Robert Wood Johnson Foundation. And then some of our partners are the Bipartisan Policy Center and the Center on Budget and Policy Priorities. These organizations were key to helping develop and shape the dashboard. I just want to pause before I go over to the website demo and see if there are any questions in the chat.
No questions in the chat right now.
Okay, feel free to chime in with a question if you have one. I believe I need to switch my screen share to the website to do a walkthrough, but please make sure if you have any questions. Yep, we'll send the slide deck after the session. Sorry, seeing another something in the chat for us. We will send the slide deck and we'll also send the recording so you can share with colleagues. Okay, can you all see my screen now? I'm back to screen sharing. So this is our homepage. From here, you're able to either jump right into the district that you're interested in looking at, or you can search for the district that you're interested in by address. I thought it might be fun to pull someone's district from the chat. I see Arizona 7th, so I'm gonna go for it. So what this does for us from the homepage is we're immediately in a health snapshot view of the district that we've selected. So for Arizona 7th, we can see for every measure we have on the dashboard, what the estimate or value is for that district, how it compares to the US average. And then you can hover and see what the US average is, so you can get a little more information on that comparison. So this is for all of our metrics, and it's in alphabetical order. I think one of the cool things about this page that we've done is that you can filter by domain. So say you're, only interested in clinical care measures, you can do that, or you can say, I want to know, clinical care and teen births, and maybe I want to look at teen births and prenatal care or uninsured, and you can kind of look at those measures together. And if you're interested in exploring more about any one of these, you can click on the metric and it'll take you to a map of the district, and then you can sort of explore it in a different way. So here I'm able to click on, the orange outline indicates this is the district that I'm in, but I can also look at surrounding districts in the Phoenix area and say, oh, okay, that's a big difference in those areas. So this is a measure, designated primary care shortage area. So this, we have at the top a sense-making statement. So it kind of tells you what this actually means when you're looking at the number 16%. It's that an estimated 16% of the population is living in a designated primary care shortage area. And then it gives you the national average. We also have the scale bar up here to give you a little additional context, visual interpretation of the data. One of the things that I'm just going to toggle back to the health snapshots for a moment. I kind of jumped ahead. If we're back on this page, another thing that you can do on this page that can be helpful for meetings or sharing this information with others is that you can print the page. So you can literally print it, or you can print to PDF and then use that in meetings or share it with other folks so that they can see, the sort of full list. The other thing that we have on the snapshot view is district facts. So for every district, we have this tab, and every state district facts where you have demographic data about the district. So population by age and population by race and ethnicity. Scrolling down, you also can see the members of Congress. And finally, this other new feature that we've added in the last year is that you can actually see which cities are in or near the district that we have also on the City Health Dashboard site. So I know a lot of folks, when you're working in advocacy, you may be looking for allies, you may be looking at, what issues are of particular interest at the city level within the district. And you can go to our City Health Dashboard website where you can see we have actually more measures on the City Health Dashboard, but most measures that are on City Health Dashboard are also on Congressional District Health Dashboard. You can see how those line up and compare at the city level versus the congressional district level. So that's our health snapshots feature. And I've already talked a little bit, showed you a preview of metric maps, but now I'm going to formally move over to metric maps. So when you click on metric maps, the first thing they want you to do, or we want you to do, is to select a metric that you want to look at. So I'm going to click on frequent mental distress. This is the measure that we have really that captures mental health. So the default view here is the national view, and then you can explore different geographic areas by clicking around, or where you have these more dense areas, you can start to zoom in and really see, what's going on in a whole state and in an area, or in an area that you want to look at. I've zoomed in too far. So this is a really nice feature. And then if I want to look a little bit more at, say, California's 8th district, then I can click on that and that will load with the scale bar specific to that district. I want to point out another thing here, which is that, you can download these images. So whatever view that you're in, whether you've selected the national view or, a state of interest or zoomed in on a particular district, if you download images, you'll get that map view, and you'll also get, you can get the scale bar as well. So in this column here, there's a lot of opportunities to kind of explore different things. If you want to select a different geography, you can do that here. You don't have to do it on the map. You can change the metric that you're looking at. You can look at different years of data. So for this metric, we have 4 years of data. The default view is typically the most recent year of data. And then you can also change the comparison value. So we're in California, perhaps I'm just interested in knowing how California's 8th district compares to the state average, not the national. And then finally, I mentioned earlier, some of our metrics are available at the census tract level. If you select the census tract, it will take a second to load, but when it does, you'll have this really detailed level of measures within the district. And similarly, you can click around and look. You can also enter in census tracts, like say you already have the numbers of the census tracts that and you're not sort of exploring on a map. You can plug those in here and then they'll come up. So let me try to, it's 314,200. So if I click on this, then it will highlight that census tract so that I know where it is. And then also it tells me what the measure is. So that can be nice if you're looking again at a particular area within a district. So that is our metric map view. The next thing is kind of a similar, or the next major feature that I want to share with you is this has a similar process for entry. We go to metrics by demographics. We pick, the district that we're interested in. Dana, is there another district in the chat?
Yeah, let's do Michigan's third.
Okay. We also have a lot of questions. I actually want to pause and answer some questions so folks feel like they can hear. So access to the dashboard. The dashboard is free. Dana, can you put the Congressional District Health Dashboard website in the chat?
Yes.
Okay, it is congressionaldistricthealthdashboard.org. And it really is free access. You can just go to the website and do exactly what I'm doing right now. The question about whether we have a schedule of when the data is updated for each source. We have grouped all of our updates into one annual update in February. So, and so far, right now, the data availability has not been affected by the federal administration, although we are looking at alternative data sources and opportunities to keep providing data on the dashboard for our users if the data is not available in the future. But right now, we have been able to continue providing data for all of our measures. We just did an update in February, and also it included some feature updates, all the data updates, and we added several new measures. So we're still going. Another question, do census tracts fall neatly into congressional district boundaries? If possible, can you talk a little more about how congressional district boundaries are determined? I can. So census tracts, I do believe census tracts fall into congressional district boundaries. I am not an expert on how congressional district boundaries are determined, but it's not our team that does that. It's the US Census. And it starts with the census, and then the states actually determine what district boundaries are, and they go through processes at the state level, and then sometimes those get rejected in courts and that sort of thing. So we keep our district boundaries up to date with what is currently active in Congress. So in February, 5 different states had gone through a process to change their district boundaries, and we updated the districts in those states. But I believe that census tracts don't fall outside of, like you won't have like a partial census tract in a congressional district, but that's something we can double check and follow up with you about. I'm still scrolling through a couple questions. Great. So a next question is also about data availability, and how often we update. Okay. I'm going to take a moment to go back to the demo so that I can answer the question about how often our data gets updated a little better. So I'm going to close out of the metric by demographic view. And just to look at like this measure as an example. So we were talking about frequent mental distress. This actually shows, if you just click here, you can get a really quick view of when the data is from, where it's from, how it's calculated. And then if you want to know more about the metric, you can go to this metrics background page, which is up here. We have all the metrics on here. It talks about where they're from, why we've added them, and maybe some of the challenges with the metric, and then how a sort of more basic version of how it's calculated. Um, for all of these data, we get them really as quickly as they become available. So this was 2022 because national data sets take a long time to collect, and then the government does their analysis. There is a several year lag for some of these measures. For other ones, like we had in the chat a question about Medicaid enrollment. Medicaid enrollment we update twice a year. And that is partially because it we can get it that frequently. Not all of the data sets are available. But we will actually be adding 2 new quarters of data for Medicaid enrollment in the next month. And right now we have basically halfway through 2024, and we'll be adding new quarters of data soon. So we'll have through the end of 2024, and potentially we're still waiting to hear back, but potentially the first quarter of 2025. We know that this metric in particular has been really important to folks, and will continue to be so. So we're really committed to making sure that the latest available data is up on the site at the congressional district level. If that doesn't answer your question, feel free to come off mute or to have another question in the chat. So I'm gonna just kind of run through the other pieces quickly. You had said Michigan. What was the other Michigan district? Michigan 3rd. Okay. So once you select a district that you're interested in, you can easily see by what's even available to click on what measures we have demographic data for. So I'm going to click on cardiovascular disease deaths, one of our health outcomes. I think it's going to take a second to load. There we go. So this shows the sex breakdown for cardiovascular disease death. So you can actually see there's a pretty big difference between females and males in Michigan 3rd. And then you can see the race and ethnicity group breakdowns as well. And you can see that there's a lot of variation here. So it shows the overall average and then the comparisons among the different groups. Another one where we have, oh, sorry, I clicked the wrong thing. So I'm going to switch the metric. I'm looking for one that we have age groups for. So for unemployment, we have sex, race and ethnicity, and we also have age groups. So this really shows you across I think really relevant age groups and what unemployment is. This is very interesting. I'm seeing that in the age group of 16 to 19, there's a higher rate of unemployment than any other age group. So that's our metrics by demographics. Similar concept and approach to how you can look at metrics on metric maps. You can change the district, change the metric, change the time period. This is an example of a data source that we have from 2023, so that's more recent. And then finally, we do have this compare districts feature, which allows you to look at on a single metric how different geographies compare in another way. So I'm going to go back to, oh, does anyone know what district Philadelphia is in? I wonder if it'll tell me. I assume Philadelphia has multiple congressional districts. So many in or around. Okay, that's New Jersey. Interesting. So I'm gonna click on Pennsylvania first. If we wanted the exact member, we'd have to do a street address, but we'll do this one since we've got someone from Philly on here. So I'm also gonna type in Pennsylvania second and the state. And so what populates on this page when you type in multiple geographies are these cards that are just kind of visually appealing and downloadable for uh, providing the measure at the geography that you're interested in. So you can see the scale bar here at the top. We start always with the US average, so you have that comparison. And then the scale bars populate for the whatever you've entered. So you can really see the variation for statewide, the difference between these two districts that are likely neighboring districts, and then how that compares up here. And then, like I said, you can actually, print this page as well and get these kind of more visually appealing cards. And they also say the data source and how when it's from at the bottom. I've kind of gone over everything, but in a little bit of a weird order, trying to answer some questions. I'm looking to see if there are any more. Just there's a couple comments, which is great. I'm happy to answer more questions, happy to have folks come off mute. If you have a question that, will take us somewhere new on the website, I think everyone will benefit from that. So I'm happy to do that demo. Trish, I'm seeing your question that's about the City Health Dashboard. And I think that is a different, we'll send you the link to the virtual office hours for City Health Dashboard, but there are ways to compare geographies in the way that you're talking about, but I don't want to jump over to our other website right now. But it's a great question and a great point that folks might sometimes be looking for opportunities to explore measures that are similar from what's a geography that has or what's a congressional district or what's a city that has a similar measure to mine. I'm seeing a question from Elizabeth, if the map images available in a high res format that we could incorporate into advocacy materials with appropriate citation. Yes, that's our hope. If for any reason when you download a map, it isn't high res enough and you're trying to use it, let us know. We want people, like that's why we created the downloadable images and scale bars, maps, so that you can use it in your advocacy or in whatever, bringing people together in the community to talk about an issue. Our email address, I think if you just click here, it'll pull up our email, but it's info@cdhealthdashboard.org. And that we'll also put in the chat. I'm gonna try to share another slide where we have some of this contact information. Sorry, Dana, for jumping back and forth between different screens. I know this is not the pretty version for you guys. Okay, great. Dana just put our general info@cdhealthdashboard.org email in the chat. You can also find us on LinkedIn and follow us. We also have a newsletter that you can subscribe to stay up to date on our updates. That's here. We send out a regular newsletter, and we also send out updates when we do big releases. So like I said, in August, we're doing a Medicaid data update, and we'll let folks know as soon as it's up on the website. Thanks, Dana, for putting all those links in the chat. Are there any other questions, any aspects of the website that you want to see again or that you have questions about?
Hi, Hannah. This is Trish. Really appreciate the information. This is so amazing. I've been following you guys for a while, and yeah, I'm just getting to follow up on the compare feature. I guess like so. I'm trying to think. And sorry, I used examples from the city, but it's something like so. If I type in, like Michigan third, and I want to see, what are the other congressional districts so that I can understand which like advocates, like which of our elected officials need to like work together on the same issue. Is there a way to do that without me having to know like already which district to compare to, if that makes sense?
That totally makes sense. Can you still see the website?
Yep, yep, it looks great.
Okay, great. So I'm doing I'm doing a screen share. So right now, on the Congressional District Health Dashboard website, we don't have a way to say, oh, I can generate a list of, congressional districts where you have similar measures. What I would do, I used to work in advocacy, and I worked in New York on health and health related issues. So what I would likely do is select an issue. I did, some work on diabetes. So just as an example, sorry, I keep right clicking. I would start here and I would say I want to find some allies in the New York, congressional delegation. And I would zoom in and click around and look at districts and different measures and see sort of what potential allies or comparisons I could find based on the color, because the color is telling you where it is on the scale bar. And in some cases, uh, you know, you may find that something is actually closer in number than it looks or farther away. This is an example of one. So these are two neighboring congressional districts, and they have pretty different um, levels of diabetes. So I might look at, what are these districts where we all have the same, or what's this district that's really having a more challenging experience, clearly, compared to the rest of the city. It's above the US average, and likely above the state average if we were to look at that. Oh, no, the state average is 11.3. So I'm getting all three numbers right here. So that's how I would do it, Trish, if I were exploring. If I wanted to look at like a broader geography, it's a lot of zooming in and zooming out and clicking and seeing what the different measures are. That's the way we have to do it on the dashboard right now. One of the things that's really fun about the dashboard is that we're always exploring new features that we can add that will help people better, be able to engage with the data and be able to use it in their work. So I think what you've given us is, with your question, is a prompt of, it sounds like that would be useful in your work. What could we do to help make the website, to make that possible for you to do without this sort of, especially if you're doing it on like a national level, what members of Congress do you want to target? That clicking around thing is a more tedious approach, certainly.
Yeah, no, and this is super great. Yeah, if there's, I'm always looking to see how we can, automate things to help with the analysis. But this is a great approach. Appreciate it. Thank you so much.
Thank you. Any other questions in the chat, or if anyone wants to come off mute, happy to chat.
Yeah, I just want to chime in and also say that all of our data is completely available to download as long as you have Wi-Fi. So, Hannah, do you want to switch over to the data access page? Or I can also do that. And we just updated the feature, the data download feature, so you can filter by metric or by state. And then you can, let's say you're interested in one metric, you can download all the data for that, and then it goes into a CSV. So if you're familiar with like Excel, you can kind of filter there to like show the estimates by like the size, and then that might be able to help you and see like which districts have very similar averages or different ones. I'm going to share my screen. Let me.
Yeah, thanks, Dana. Susan, for Delaware and for any other states where there's just one congressional district, that's certainly a challenge. I think the major way that we have to explore at a lower level geography on this site are when you have the census tract data available. We are exploring adding an opportunity to look at sort of groups of census tracts so that you could, select all the census tracts for a county perhaps, and then get the county level estimate. That's a research, a frontier of research for our geospatial folks, but it's a good point that is something that's that you need in our smaller population states.
Thank you, Hannah. Again, it's hard to work in the environment because they are very, very different. It's amazing how different they are across the geography of the state. So we're always trying to make sure that we're not basing everything on one population versus another, because there are some major differences. So thank you so much. This is a great tool. I look forward to using it more.
Awesome. So happy to hear that. Thanks for your feedback and your question. Dana, yeah, tell us about the download the data tool.
Yes. So when you're on our page, if you go to the menu and access the data, you probably just saw me messing around with the first page that you saw. So we just require a very brief survey. Just ask for your email, your zip code, and just like a couple of questions. And then it brings you back to this page. You can download a data dictionary. So that includes like some like a code book. It's basically a code book. So to help you when you download the data. And we also provide a technical document showing you like all our methodologies and our data sources and such. So this tool specifically, you can like select a metric if you were only interested in one, let's say, and then you can filter out by states or do select states. And then for some of our metrics that have the track level available, you can also toggle this and then download it. And then on the flip, you can also download all of the data by state. You can select different metrics or include all, and then you'll be able to download that. And all of that is also as a CSV. And if you had any trouble accessing the data, or if you had any like specific questions about our methodology, feel free to send us an email. We're always like trying to help our users better understand like data and what we do. So just shoot us an email at info@cdhealthdashboard.org.
Thank you. Any other questions?
I just asked if there's a preferred citation that you'd want us to use when we use this data.
Yes, there is on the access the data page, and I'll also just paste it in here. We do provide the preferred citation, and I just pasted it in the chat.
Thank you. I try to train students to realize that their hands will fall off if they don't cite data appropriately.
We appreciate it. Thank you. And if you, feel free to send us an email and share a little bit more about that research and work too. We're always, curious to know how our data is being used, and we would love to hear from you.
This has been a great session with you all today. Thanks so much for joining us. Dana said it a few times, but I'll underline it again. We're happy to hear from you. Please reach out. Subscribe if you haven't already. Follow us on LinkedIn to stay up to date on what we're doing. Yeah, thank you. Hope everyone has a great day.